Hello and welcome to Talk of the Town. I'm your host, Christine Fenner. This show is about bringing you interesting people and events throughout our community. And here with us today is Dr. Stephen Lyon from Stoughton Hospital. Welcome.
Thanks. It's great to be here, Christina. It's great to have an opportunity to talk to you about a problem that I'm sure affects a lot of the viewers, chronic sinusitis.
Now, I understand you have an event coming up to explain this to the community.
Right. Stoughton Hospital has a forum that allows surgeons to present new topics to the community. And on April 3rd, we're planning to give a presentation about a new device that's being introduced in the management of chronic sinusitis, which affects a lot of patients in Wisconsin and really across the country.
So what is this new ENT procedure that you are performing?
Well, as a surgical specialist, we're continuously trying to refine the way that we approach trying to manage these problems. We want to try and find approaches that make treatment simpler, easier for the patients, more comfortable, more effective. And what we have is there's a new device that is essentially a drug. It's known as a drug-eluting stent or implant called Propel. And it's a device that's placed right into the sinus cavities at the time of surgery. And during surgery, what we do is we open up the sinus cavities to allow access. And what this device does is it deploys right at the surgical site. And it was a great idea because it allows the surgeon to place a device that will continuously deliver medication right at the site of disease that stays in place over the next 4 or 5 weeks and then dissolves and maintains that opening that we established at the time of surgery. So it's really a great tool. It's a great new tool for us to use to help patients make that transition after surgery and make the surgery more effective.
So who is a good candidate for this Propel procedure?
Well, many of the patients have had trouble with sinus problems for years, and they might have had surgery before. They've probably been to their doctor multiple times. They've had various treatments, multiple medications, and yet they're still not really getting the relief that they'd like to get. So patients who really find themselves, sometimes, they resign themselves to just living with the problem because they're not able to get good relief. Those are the people who I think we can really help the most.
How long have you been doing this procedure, and where do you do this?
This is a relatively new procedure, but we're fortunate enough to be doing this locally at Stoughton Hospital and at St. Mary's Janesville Hospital, and this is a procedure that we've been offering there since about November.
And what have you been hearing from people who have had this procedure?
Well, one of the nicest things about doing this is that people really feel a sense of immediate improvement most of the time. So when they've suffered with not being able to breathe through their nose, having difficulty sleeping because they can't find a comfortable sleeping position, having headaches, having to go in to their doctor repeatedly for medications and treatments, what we're hearing is that they can finally breathe through their nose. They can avoid having to think about their sinuses all the time, and that they can just start living, a normal, more symptom-free life. And it's really refreshing to see people get those types of results.
So you mentioned this is like a stent that delivers medication directly to the source.
Right.
How does it relieve the symptoms then?
Well, what we've learned is over the past several years, chronic sinusitis and polyps, when people hear those words, they should think of mucous membrane damage because that's what's occurring. It's like that the body has a switch that's been turned on that should be turned off. And the switch causes the body's immune response to actually damage the lining of the mucous membrane, so they can't function normally. These people can't smell frequently, they can't breathe very well, and the stent is placed right into the sinus and can deliver medication to help turn that switch off, turn that inflammation off, and it sets the stage to be able to heal the mucous membrane, because once the damage is healed and that mucous membrane becomes more healthy, then it functions normally. And the patients start to feel normal, and then their symptoms end up being better controlled. They don't have to go in for medications all the time and things like that.
Sinus issues seem to be a common problem. When should someone see an ENT?
Well, when patients have problems that they feel are not being adequately addressed, with the medications that they've been on. If they feel that they may not have the proper diagnosis, or if they don't really know what's going on. I think one of the nice things about ENT is people generally know that there's a problem, okay? And they generally know that they have a problem in the nose and sinuses. One of the tough things is they don't frequently know just what that is. So if they're either having trouble getting good relief or feeling like they're not treating things properly, then it really helps to come in, get that evaluation established.
Well, thank you so much for joining us today and explaining this procedure. We look forward to the event coming up on the 9th, on the 3rd.
Well, thanks for the opportunity. Appreciate it.
And we'll be right back with Talk of the Town.